Danae, is there a way to print this for me to print it?
You should be able to print the document off your email if you open it up. I mean, is that what you're asking? I'm sorry.
Well, I forgot it was on the email. Sorry.
No, that's okay. Yeah, I just sent it. It should be at the top of your inbox.
Yeah, I got her here. Yeah, we got her. Thank you. Okay. Chief, are you planning on taking roll? Or at least checking names off from the photos, from the pictures?
I will take attendance like I did last time. I'll write down everybody, and then I keep a spreadsheet, Tom, that I have, like the last one, everybody that was here, and then I'll do the same thing for this one. So if you at any point want a list of who all was here, I have that.
Okay, so we don't have to review the names. all
No.
the ones that are there. Okay.
No, I think there's going to be, depending on how many people show up, probably close to 25 to 30. So I think we save some time and work to just get our work done rather than introduce everybody again.
Yeah, I wouldn't want to do that anyway. Okay.
I know we're going to have Tom, we're going to have a couple of people that are new tonight. I think maybe we have them introduce themselves when we get there.
Okay.
Julie from the Center for Mental Health, Leo Gallagher, the County Attorney's Office, Jaden, I'm not going to try to butcher his last name, from MCRT, Jen Gursky. So I think we give them an opportunity to tell us who they are, and we go from there. What's your thoughts on that?
Yeah, yeah. Well, I'll pick up on whoever raises their hand and we'll go from there. How's that?
Okay.
Jen Preble, if you're able to hear the audio, I'm sending you a invite to become a panelist so you have access to your mic and video. But you do have to accept it. It might be buried on your screen somewhere.
Well, we have 22 and it's time. Let's give it a couple more minutes, see what we got.
Hi, Jen, this is Danae. Can you see the panelist invitation anywhere on your screen?
Okay, I think we have 29 people. Welcome. It's good to have you here for the Mental Health Working Group, session number 2. I'm Tom Cordingley, the facilitator, and with us is Chief, what is your name, Chief? Steve Hagan. And we also, I believe we have, I don't have the list in front of me, but we should have some city and county, city people with us. Commissioners, are you here?
Yes, I'm here.
Sean Logan is here.
And I am also here. This is Commissioner O'Loughlin.
Heather's here. Okay, good to have you, folks. We also have the city manager monitoring this. Just
Good evening.
hello, welcome aboard.
Thank you.
You're welcome. Let's the agenda is laid out right now, if you can see it. We're going to have, besides the call to order right here, we're going to have some introductions of people who were not here before. I don't have all the photos out. Who is here that wasn't before? Jen Gursky, are you here?
I am.
You want to introduce yourself, please?
You bet. Hi, all. I'm Jen Gursky. I'm the executive director of YWCA. We are a 2.1 state endorsed recovery program, truly in the heart of Helena, so downtown, right beside Mr. Hagan, Chief Hagan, down the block. We're also working on a mental health center for children's therapies. We house residentially up to 24, but on average 20 women with about 15 kiddos. And we just opened trauma-informed and therapeutic childcare.
Thanks, Jen. County Attorney Gallagher, are you here?
I'm here. I'm the county attorney.
Hi there.
Hi.
Thanks for that great introduction.
Yeah.
Yeah. Who else is here that wasn't here last time? Speak up, please.
I'm Julie Prigmore. I'm the Recovery Services Director for the Center for Mental Health.
Hi, Julie.
Hi.
Anybody else? Okay, we'll call it good. Welcome, you guys. In session 1, we mostly spent our time with introductions, and we've got a really powerful group here from all over pretty much the city, and mental health experts from all over the place. And it really was enlightening and a positive attitude that we have, that we think we can solve this issue that the city has asked us to do. I'm going to switch over to Chief Hagan in a second. Well, let's do it right now. These are our goals. And Chief, do you want to go over what we've written them and really come in to clarify what's needed? Sorry for this, but go ahead.
Okay, Tom, I'd like to just kind of touch base with everybody, and what we sent out some questions, and by the response to that question, we figured we probably should narrow down what we're trying to do with this working group. I just want to remind everybody, we've been tasked by the City Commission to put together a working group to see if we can come up with a good model for law enforcement response to mental health. And in addition to that, what are the barriers to that model we would like to implement? The option is also always to say, no, we don't want to change what we're doing on the law enforcement response to mental health. But we would like to try to work through it tonight. And if we can't get it done tonight, maybe one more meeting to try to come up with a recommendation for the City Commission for a new law enforcement response to mental health. And when I say law enforcement, in this case, I'm specifically talking about the Helena Police Department. So after we got our questions responded to, I spoke to Tom a little bit, and I think we need to focus more on exactly what we're trying to accomplish here. everyone had great ideas, but I think they were too broad for what we can do in a short period of time. So what I'm going to do is just kind of go over what a typical call looks like for the Helena Police Department and how law enforcement generally, law enforcement and mental people suffering from mental illness intersect in our community, and then talk about what help I believe we need. So I'm going to start there. I can screen share and hopefully it turns out okay.
Chief, if I may add to this, we do not, we're not depending on the chief to tell us the right or wrong way to go. This is up to us to come up with a solution, whether he likes it or not. Besides, he's retiring in 3 weeks, so what do we care?
You
Go
should
ahead.
care. I'm a nice guy. Okay. Tom, can you see the full screen of this?
I hope so, yes.
Okay. So I need to close something. Hang on. All right. So this is basically how I'm going to line out how we get a call, any call, and how it ends up intersecting with mental health in most occasions. So I'm going to have to reach to the side to get this to cycle. Sorry. So I'll start with the very beginning of a call. All calls in Lewis and Clark County all come through our 911 center. That's 911 calls and non-911 calls. Anybody that's asking for services from the police department, sheriff's department, medical, fire, they all come through one public safety answering point. And it's the only one in Lewis and Clark County. So they're answering all of the calls for Lewis and Clark County. And typically there's two to three dispatchers on at any given time. And they briefly screen the calls and then they route them appropriately. And basically police get most everything that does not fall into fire or medical. And the reason I bring this up is one of the things we have to look at, and one of the barriers that I see is if we're going to burden our 911 center with additional work, we're going to have to put resources that direction as well. We can't forget about how whatever our response is affects the 911 center. So calls that are sent to the police department are answered on priority basis. So the more serious calls are answered quicker. Most of our calls are answered within an hour or two, depending on the level of the call. The police department receives about 30,000 calls for service a year. 3 to 5% of these are involve people with mental health issues. This does not include substance use disorders. This is different types of mental illness besides substance use. The police department generally has 4 to 7 folks on staff at any time. And that totally is dependent on staffing level, which right now we're down 5 officers. The day of the week and the time of the day. So we stack our shifts heavier during our peak call times. The officer responds to a call, and that they either respond to the call or they answer it they give them a call on the phone. And we generally have very limited information on what's occurring. So that's what we're trying to establish when we get that call. First thing we got to figure out on those non-emergency calls, has a crime been committed? And if a crime was committed, does that person want to pursue charges? And where that comes into effect is we deal with a lot of trespass calls at different businesses around town. And these very frequently involve folks with mental illness. The businesses don't want them there. So they call us to remove them and tell them to move on. And a lot of times they don't want to pursue a complaint. So then we look at, well, how do we resolve the issue? So if the person's an immediate threat to themselves or someone else, or unable to care for their basic needs. So if that fits, then it fits the criteria under state law for a protective custody. And we'll either do a protective custody and or work with the mobile crisis response team. And that may still result in a protective custody, or the mobile crisis response team may come up with a safety plan. If it doesn't involve mobile crisis response and it involves mental health, we tell a person to contact their counselor if they indeed have one, and then we go to our next call. So this is why we're here today. I personally don't think that a person suffering from mental illness that doesn't meet the criteria for a protective custody should just be basically left to fend for themselves. Most police officers got into the profession to help people. Continually responding to calls involving the same people over and over with no help is a terrible way to serve our community. And quite frankly, it takes quite the toll on law enforcement and our community. When law enforcement does have a fairly high level of diagnosable mental illness, PTSD and things like that. And it impacts law enforcement in multiple ways. Right now, if we arrest somebody and they are suffering from mental illness, the jail has resources. Of course, they need more, but they have resources. Once they're done with the jails and go through the courts, there's resources there. Again, courts need many more resources than what they have. We do need, and Judge Peterson has started on a very low level a mental health court, and I know she wants to expand that, so that's something we need to expand on. And then there is a law for those people that are in a serious crisis that are a threat to themselves or someone else. And this is where the gap basically is, and this is where we need the help. We need resources to help those that don't fall into one of these categories. This is not just about crisis mental health care, but it's getting boots on the ground. It's basically getting the mental health professionals in the field to meet the consumers where they are and providing assistance so they don't get to that crisis level, so they don't keep dealing with law enforcement. What I've seen in a lot of places, the CAHOOTS program out of Eugene, Oregon, and various programs around the country is they have case managers, folks that follow up and make sure they're getting help, check on them. If anybody watched the Joe and Ernie video that was sent out about the San Antonio Police Department and their mental health program that they're working on, they also have those officers. They basically work as case managers. There's been a lot of talk about the journey home, and I believe if it gets reopened, it needs to be structured so they take folks that are in mental health crisis directly from the officers. When the journey home initially was built, that's what we were promised, is that they would take directly from the officers. However, basically what occurred all the way until when it was closed is we still had to take people to the hospital. They had to be cleared by the hospital, and then they may or may not be transported to journey home. So under that format, it adds work and it doesn't necessarily relieve officers of the duty of placing people in protective custody and basically staying with them for long periods of time. So we need the help. So what does that look like? That's basically what this group was formed to do. And again, this isn't about what I want. This is about what the community wants. And we are tasked with, as a group, to make a recommendation to the Helena City Commission on a top model of a law enforcement response to calls involving people suffering from mental illness. And as you notice, it doesn't say crisis mental illness or anything like that. It's mental illness in general. And an additional goal of the group is to identify the barriers to the implementation and basically recommendations on how to address these barriers. So with that, I'm going to turn it back over to Tom.
And let's put our notice out for public comment. Does anyone have any public comment at this time? This will be the only time we will be asking. Public comment, please.
It's all yours, Tom.
I'm here.
We can't
Public
hear you.
comment? Seriously? Public comment? Can you hear
I
me?
can hear you, Tom.
I'm here. Any public comment? Public comment? Can you hear me, Chief? Too many sirens?
I can hear you. I don't know why other people can't, but I can hear you.
Anyone here, Tom?
Nobody wants to hear, Tom.
Okay,
Tom, I
I
can
can't
hear
hear
you.
you, Tom, just so you know. I'm gonna
All
try to
right.
figure out what's going on my end.
All right, well, too many bullets. All right, no public comment. Let's move on to the discussion of the materials. What the responses that we got were good, and they went a little further than what we were focusing on. I think the point of this group is what response do we want from the police and or hospital for mental health calls? And once the CRT people get these clients, that's beyond this meeting. Am I right there, Chief? That make sense? Okay. So,
Yes, I'll just say, since he's out, I'm not sure where he went. Yes, that's correct.
thank you very much. So let's figure out, do we want the police, who frankly they're down 5 people, do we want the police to go first and make a call to clear the area and then call the CRT people? Do we want them to go with the CRT people? Do we want the CRT people to be told to go out there once dispatch has figured that it's not a legal problem, a lethal problem? Let's get some talk going on that. I would think that the first subject that would come up with, yeah, we want police to go check it out. And if it's not a crucial call, if that's the word I want, we can bring in CRT and then the police can go back to continuing on their duties. So do we have any ideas other than those? Zach, you're on dispatch. What would you, which way are you leaning?
So I guess I spent a lot of time looking at different models. Specifically, there's one in Denver where they have a designated team that involves a paramedic and a mental health professional. I did reach out to them. I just haven't gotten a response back to them because I'm curious to know the questioning process that their dispatch center uses, because they process calls. If it meets a certain criteria, they bypass law enforcement altogether and they send only that team out. And so I'm just curious to know, I guess, if they would give me that information of what what questioning or line of questioning they do with their callers to make that threshold to determine, is it going to be a law enforcement response or not? I know a lot of the articles I read, same thing, is it is a safety issue, because there's a number of articles out there that teams have gone out and they did get assaulted. So over dispatching. So there are times that if we send them together, may be an option. But again, that goes back to availability of those members on that team.
Okay. Is somebody, nobody?
I'm going to raise my hand here. This is Jen. I don't know.
Yeah, go ahead, Jen.
Not working. But I think I just have a question for clarity. If officers are not dispatched as a first response, like that's not our default response, who's doing the evaluation of what is actually needed then? So is that the caller in to dispatch? So let's say local business A has the trespass call in, like Chief Hagan said. Who determines if that person is at risk of harming others or harming themselves at the point of that call to determine who would be dispatched then?
Chief, do you want to answer?
I would think most communities in that particular case, since it is a criminal type event, they would send law enforcement first. And then in most places that have mental health units that come out to the scene, they would then request the mental health folks to come out. And that's really what I would would see or see us doing as well, because you don't know exactly what's going on
Yeah.
on that type of call. But if you had something, a welfare check where, you know, someone was depressed, law enforcement goes to that now, that might be something where it is just the mental health professionals.
And the
Good.
difference between that is because the caller assesses that it's just a welfare check.
Well, it would be assessed through the dispatch center, and a lot of places have. So what they do for medical calls is they have what's called emergency medical dispatch. They ask a series of questions, and the places that I've seen that has a dispatch center doing screening does something similar to that. So it would be it's pretty much always the dispatch center that makes that determination.
So I have one more follow-up just for some clarity in this conversation for me. I'm hoping this is helpful for folks, but so the assessment, so what you're saying is that officers would be sent to a business because it's criminal aspect of trespassing versus a caller in for a welfare check is more than likely a behavioral health check. Is there an opportunity to tease out the small business owner what type of disturbance the individual, so that that call can be made similarly to how you would dispatch a welfare check?
I'll let Zach answer that one.
Sorry, Jen, I guess I just want clarification. So are you looking how we would process, like if it was a citizen calling in saying there's somebody trespassing, or a business?
I'm trying to get the root of like really truly understanding the capabilities and the capacities of answering the question that Tom just posed. So do we want for behavioral health type issues, the default answer to be law enforcement dispatched? That felt like kind of like what was the question. And maybe Tom, if I didn't nail that, if you could reframe. So I guess I'm trying to think of if there is a different response between somebody who already assesses in the caller as it's a welfare check, dispatch like works it through. Okay, it's probably not a threat to a crisis team that would show up like a physical threat. Okay, I don't think we have to dispatch law enforcement. What would be the barrier of dispatch walking through a trespass case or something like that to see if the person was not a threat, was probably in that moment not stable, dysregulated? Why is there a process there to evaluate that you wouldn't send law enforcement at a call that would probably be beneficial for a mental health response?
So I think
that have something to do with weapons. That'd
Right.
be a place to start.
I think it'd be basically our normal line of questioning that we do almost for every call we take. So the access to, or if the caller sees weapons, or if it, say in the case of a welfare check, I know one of those was an example is, okay, it's a welfare check, so some, or the mental health unit side of it. The catch to that is, well, our follow-up question with welfare checks is we always ask, do they have weapons? Do they have access to weapons in the residence? We're all very aware it's Montana, especially Helena, avid hunters. So usually in residence, there are firearms. And then also, if one of the follow-up questions we always ask is about past history. If they've attempted in the past, how did they attempt? Was it an overdose of medication, or was it with a weapon?
Okay,
and I think
so
those
what type of assessment would be used in the trespassing scenario?
So trespassing, I guess that's where it would have to, it depends on what the caller would say to us. Because if it was just simply a business or a residence calling in saying, hey, there's a transient that's here sleeping. A lot of times they'll say they're not acting right, and we have to try to pry that information to define what that means. And a lot of times we don't get that answer.
Sure.
So again, that's why we default to the law enforcement side of it.
So that's where the crux of my question is. So we
Yeah.
default to law enforcement in the trespassing case because.
Right. So I guess, and part of that is, so trespassing, the chief can correct me if I'm incorrect, but the trespassing part does still fall under a criminal statute. Whereas a welfare check for, like, say, a suicidal subject, something like that wouldn't per se fall under that.
Okay.
So I guess that's where I would think that our center would go to, trying to make that difference. I mean, hopefully that kind of narrows it for you.
And if this is not helpful, please interrupt me. But I guess what I'm wondering is, as Tom posed the question, what's going to be our default response? It sounds like what you're saying, our status quo response is because it meets a code that law enforcement must meet.
I would say it's the default because that's how we've done it. And we
Okay.
haven't really looked at anything beyond that, except for this panel.
Okay.
Yeah, and I would agree with Zach. I think it's currently our default and it will be until we get something better in place.
Right, which is what this conversation group is. So I
Correct.
guess maybe then my question would be is is it possible, so as some sort of response and trying to get some work product out of this meeting, right? Can a level of evaluation be done by training dispatch about what type of team to dispatch into, whether it's trespassing or not, the same type of evaluation that you're giving to welfare checks?
It would absolutely have to be a part of any additional mental health resources we put in the community would have to include mental health training for dispatch to properly know what folks can go to. And a lot of it's going to depend on what the mental health professional's comfort level is with
Sure.
going to those calls as well.
Okay, I'll pause and let somebody else talk.
No, these are good questions. I do want to say that the Cahoots program doesn't exactly use the hospital scenario. They would use a how would you call it? What would you call it? Welfare. It's something like Good Sam. Good Samaritans have a person that goes out on the street and
Like the HOT teams, the homeless outreach teams, like
yeah,
the pod uses in Missoula.
yeah. Well, I don't know. I can't compare, so I'm going to say yes. And
Can
then
I take over for 1 second?
you can take over for this whole hour.
So what the Cahoots program out of Eugene, Oregon, it was started by law enforcement about 10 years ago because of this very issue. And they're contracted with a local nonprofit that gives 24/7 mental health response to calls in conjunction with law enforcement at different levels. And it's exactly what we're talking about tonight, which is there's times they go out alone, there's times they go out with law enforcement, and there's times that law enforcement goes out and then calls and says, hey, we need your help. They have case managers, they follow up, but it's run through mental health, and it's run through a nonprofit, and it's basically contracted with the city. Some of the funding comes from nonprofit world and some of it comes from the city. I don't know if that helps, but that's kind of, right now it's called the gold standard around the country. Everybody's going there to learn how it's done. But it is very much a law enforcement.
If it's the gold standard, Chief Hagan, what's the barrier from implementing that here?
Money and resources, money mainly, and resources, people to do the job. Sorry, what?
Nothing. Go ahead.
I forgot to put this as part of my presentation. I did talk to John Luca. He heads up the MCRT, and we're going to try to increase their role within the community. We're going to basically, whether we got the resources or not, we're going to work with MCRT to see if they can help us with some of these calls, and they're going to tell us yay or nay they can't. And we're going to adjust a little bit on how we call them out. So we have a monthly or bi-monthly meeting, and we do have at least one of the counselors that responds. I think Jaden's on that, and we're looking at ways to improve with the resources we have. And my personal opinion, and again, it doesn't mean you have to take it for anything other than an opinion, is I don't think we should recreate what we have. I think we should develop on what we have. So I don't think we add a third team. I think we increase the workload of the current team we have, the MCRT, and look at how we can get them more resources. That's my opinion.
Chief,
So-
let me ask one question here. What is the difference between the nonprofit doing it and the current CRT from St. Pete's? What?
Well, St. Pete's is a not-for-profit hospital. I don't see that much difference in,
Grants.
yeah, it's paid, the current system is paid for by grants.
It's money. So I have one more question based on that, Chief Hagan, because it actually sounds like you have a recommendation. You know, like a lot of us have folks that we report to and we need to come with recommendations. I value that. Resources as in finances, I think is a city commission and city manager conversation. Resources as far as personnel probably goes to this group a little bit more about what that staffing would look like. But what are the financial resources that it would take to get your dream of is it called the Cahoots?
Yeah,
I
and
love that name, PS. What would it take?
I have no idea.
Ballpark it.
$1 million a year. Because you have to have 24-hour day service coverage. You can't go with coverage some parts of the day, not parts of the other day, because you never know when those calls are coming in. And that costs quite a bit, and you're going to have additional people besides the people that respond. You have to have case managers to follow up. So I just throw that number out there. I don't have a number. And right now, I think one of the bigger things, even besides money, is there aren't a lot of people. There's a huge shortage in the mental health world, workers. So I'm going to stop taking up all the time.
I feel that every day. And Tom, I'm going to stop too, but I volunteer if this committee moves forward that I will help with any grant writing necessary.
Yeah, great. Julie, you've got your hand up from the Center of Mental Health. What do you have?
Yes, I had some, I guess, comments and observations. So a couple of the things, I think any crisis team is going to have a centralized dispatch process just in general. And as to how that goes, right now, it sounds like the only option is the police department. There is something you could do as far as having even a mental health professional hanging out in the dispatch if you wanted to look at something like that. I know organizations that have done things like that. That way somebody is triaging in the dispatch center and then can make better calls as far as where it needs to go. The other pieces I have questions about is, are we looking, I think there's a difference with high utilizers versus those people who are unknown to us, because high utilizers, we may be able to access more easily without law enforcement having to be part of that situation, whereas unknowns might have that more dangerous component to them. And I think we do have to have more mental health professionals that are trained, like CIT trained mental health professionals out to assist, in the mobile crisis response component. And I do think we can pull other organizations into that and utilize those people who are CIT trained.
Anybody want to follow up with that?
Yeah, Tom, I've got my hand up. This is Jolene.
Yes, you do.
Yeah, so in regards to the MCRT, we do have professional behavioral health experts there who respond with the police, and the police have just started this past month, almost doubling the calls they're making to them, and there's a lot more room for capacity. Obviously, COVID-19 and sometimes staffing issues can create a little bit of a shortage, but the goal is 24/7, and then to also have 8 hours. We have 8 hours of Frontier telepsych available to the MCRT that's paid for through the grant, and then also St. Pete's Health contributes to that too. The funding, but also to add to Jen's question about where the funding comes from, there is the county matching grant, but St. Pete's does contribute significantly to that too. And this year, with the hopefully the Medicaid waiver happening, there is a bundle package that is being requested for reimbursement and billing for the MCRT. So there hopefully will be some sustainable funding there to add to that mix. So just wanted to bring that to everybody's attention. And Gianluca is on the line. Gianluca, you are an expert with the MCRT too. So why don't you, if you want to add to that, I'd appreciate that.
Sure. Well, what I can say is that today we had a meeting with Chief Hagan and also some members of the MCRT, and we were trying to brainstorm and find out a way how we can short the response of the MCRT to every law enforcement call. So basically what will happen, and this will be most likely effective on Tuesday next week, Tuesday morning. And the reason for this delay is that we have 3 members of our MCRT group out, 2 for COVID and 1 on FMLA. So we only have 2 this week. So this unfortunately delayed this initiative. So we'll effective on Tuesday morning. We will try to basically triage the calls through the radio and figure out if the call to the dispatch are actually mental health related calls or not. So we will have the MCRT responding virtually at the same time of the law enforcement. So this will technically short. I don't think we can do more than this. Of course, we will still have the law enforcement approach the client or the patient or whatever we want to call the person, the individual involved in the case, and because safety reason, and I don't think we can overcome this really with other option. So this is the first app that we will put together, that we'll put in place starting Tuesday morning. And then as Jolene mentioned, definitely it is encouraging. For the month of September, we doubled the call that we received from dispatch. And so this is definitely a positive. So we went through about 20 calls to 40. We actively responded to the scene on 25 cases. The other 15 were managed by the MCRT and I guess the law enforcement on the phone. But the encouraging data is definitely the 40 calls that we received compared to the average of 20 that we were having on the previous month.
Could I ask you a clarifying question? Are you determining whether you should go or not, or are you listening to dispatch?
No, we will listen to the radio. So the law enforcement radio. Our MCRT are equipped with the same radio that a police officer has in their car. So we will listen to the radio for every activity that is going on in Lewis and Clark community, and they will triage and say, okay, this is I believe most likely could be a mental health call, and they will get the car and respond to the scene. They will be around there. Definitely, they are visible and recognizable in the community because they have. They wear clothes that clearly identify them as a crisis response team member, and of course we have a car with huge stickers that identify the car crisis response in cars. So what I'm trying to say is when they get into the scene, the police officer would be aware that the mental health professional is in the area, and after a safety clear of the area, and they will interact for a second. Of course, a little interaction between law enforcement and MHP needs to happen, and then they will step in if it's the case.
Okay, so everything goes through dispatch. Jaden, you had your hand up. Did you want to add to that since you're St. Pete's?
John Luca covered it pretty well. I do know that I just did a presentation with Montana Nurse Association about this. The cahoots is the gold standard, but one of the things that's people vary even with cahoots, they have law enforcement available pretty much all the time. The only one that I know of that'll go out without law enforcement is out of Arizona, where they actually have their teams trained by in the police academy itself.
What team?
So even the mental health people are trained through the police academy. So that's where they come up with the safety part, because that's always been the concern with this, is getting out there and having people safe. Because even with people that are frequent flyers, which we handle a lot, and they'll call into dispatch, and usually we'll just call them back or we'll go talk to them. But even on them, just because they're frequent flyers doesn't mean they're always safe, because they could be under the influence. There's a lot to be considered. But I do know, like John Lucas said, we have a shirt similar to like what you would see in an EMT, where we show up and we're easily identified, and we have a car we dedicated to. Dispatch always knows where we're at, so that they know we're safe, just like with the officers. So there's a lot that does go into it that's behind the scenes before we ever get to the clients.
So by training with the police, you know what to expect from them, and they know what to expect from you, right?
Well, in the Tuska, Arizona one, they actually do, it sounded like basic hand-to-hand combat for them, which is way above what we want to do here, because we don't want to become that side of it. That was the only program that I could see doing it. They also serve court paperwork, so I don't know how they do it. It's all based off the cahoots models, but they've tweaked it to their own part to work with their mental health courts. And it was mentioned earlier about the CIT training. I'm actually on the panel for the training for CIT, and we do open it up to other therapists, and as well as any first responder, basically. With COVID, we were a little short staffed, but we brought that to Montana in 2005. And there's been about 2,800 officers across the state that are trained in them. And I know Helena sends quite a few officers every time too. So we have a lot of really quality CIT trained officers already. And our mental health professionals will help with that training if we need them.
It's my understanding that both the sheriff and police in the county have 8 hours. Pretty much everyone has 8 hours of training in the CIT. Pardon me?
Yeah, in basic law enforcement, when they go through to get their post certification, and Chief, please correct me if I'm wrong, they get an 8-hour entry level into CIT there. And then in addition to that, there's a 40-hour week class that they can attend that is specifically CIT for that 40 hours. And the last day is we work through vignettes of actual cases that's happened around the state with mental health, and we critique the officers or the participants about how they handle de-escalating these people, the clients in the scenario. So there's quite a bit that goes into it. But yeah, every officer has an 8-hour basic course at the academy.
And Tom, 8 hours for the academy, and most every officer for HPD has been through it, but it's only held once a year, and you always have staffing concerns with a 40-hour pulling an officer for 40 hours. We usually try to get about 5 a year, and we try to get our dispatchers there as well. So it's all a lot staffing dependent, but almost every officer in Helena that other than the ones that have been hired in the last maybe year, have been through it.
Okay. All right. Do you want to say something from Good Samaritan?
I had a question.
Go ahead.
If the scene is safe, will CRT be able to transport so that the police officers can leave and it's not taking up more of their time? If the client needed to go to the ER or whatever they needed to do, would CRT be able to do that?
No, at this time, we are not able to do that, and the issue is just liability. Right, we can definitely look into it, but right now we're not able to.
That's you transporting the client, correct? Is that what we're talking about?
Yes.
So
NCRT,
the police would have to do
NCRT.
that. I'm sorry.
Sorry. Oh,
Oh, we lost him. There he is.
This is Jolene. I know
Jolene.
that, yeah, I know that MCRT arranges to have transportation. So I don't know if they're using, if law enforcement is not there, they're using EMS, how they're getting somebody to the emergency room. I'm not positive on all that. So if Gianluca or Jaden can expand on that. I think we lost Gianluca.
No, for sure, NCRT at this time is not transporting any client or patient to anywhere. So the only way that transport happen is with law enforcement, or definitely if we recommend admission to the hospital. So a visit through the ER, we can definitely contact the ambulance and the EMT will show up. But definitely no, we do not transport patient at this time.
Okay. Let's get back to what the response should be. Who would be the one to initially respond in a non-threatening situation right now?
I'm sorry if I can add, the only MCRT group that, in my knowledge, that is able to transport patients right now, I think, I'm not sure if it's in Bozeman, but they have a special car, specially built or equipped for transportation. That means that the driver is completely separated by from the back seat. So, but we are not furnished right now with a car of that kind.
Interesting. Okay.
Right, Gianluca is correct. Bozeman got a former police car donated to their program, and they left that cage in between the two. So there's there's the barrier where we just have a Nissan Versa where it's what you can buy at the dealership. So there's no way to ensure everybody's safety.
Understood. And along that line, and I hope it's not off subject, we were talking last session about handcuffing clients, and some of you are for it and some of you are against it. I talked to the chief about it, and he would insist, I think it's by law, perhaps, maybe by policy, that everyone is handcuffed because you never know what's going to happen to the driver, just to be basic about this. I can understand what the cuffs can do to a person. It's threatening to them, and it's degrading and all this sort of thing. Chief, do you have a response to my babbling here?
Good segue, Tom. Yeah, and I'll give you two examples. One of them is myself, who violated policy when I was an officer on the street and did not handcuff a person I was transporting to St. Pete's. And that did not turn out well. Ended up in a wrestling match to try to get her out of the car. She started kicking the windows and smashing her head against stuff. So I learned that handcuffs, be it, they are not the best tool. They are a safety tool, very much like a seatbelt or those type of items. And we also had one where an officer was transporting someone, again, in violation of policy, but he had a counselor in the back. And when they got to the hospital, the person pulled out a knife and tried to stab the counselor and the officer. Luckily, that did not end in tragedy, but it could have. So that's the reason that it is a safety tool. I know a lot of people believe that we should not handcuff people in mental health crisis, but if we could get a non-law enforcement entity to transport and they were willing to transport without handcuffs, I very much support that.
This is probably the main question. If you're CRT, you don't know what this person's going to be doing without handcuffs. So you need the police there in most cases, I would think. It's just me talking here.
There's a lot of times that I have transported clients when I feel safe and I know the client. So not always is it a bad thing.
All right, can you speak for a Good Samaritan? Much like Cahoots has a nonprofit working for them, would Good Samaritan be in favor of doing something like this if they had the grant money?
Yes, and we've actually been talking with Kelly McBride about Intercept Zero and trying to get that started.
You want to explain what that is, please?
That's just like the other programs. So it would bypass the police, and on any calls that are not dangerous or criminal activity. So let's say the trespass, the business didn't want to press charges. They just want this person out of there. We could go out there and talk the person into leaving, just get them out without involving the police and saving them that time. I've gone out on calls before that they wanted, they were actually tearing a guy had made a house, and it was a safety hazard where he had it, and he had a fire going, and they didn't know how he was going to act. And so I went out there and we just chit chatted for a while, and I took him to coffee, and everything was okay. I mean, the situation was fine and worked out. He moved on. So things like that, where we can be helpful and it's not taking up more of the police time than is necessary and wasting that resource. So they could be out on a more important call.
Yeah. Do you worry about certification doing what you're doing?
No.
Okay.
Certification in what exactly, though? I guess I should ask.
I would think in mental health counseling, things like that. Or are you volunteers helping out Good Samaritan?
Well, I've gone through peer support and CIT. So, and I've been doing this for a long time.
Okay. I haven't, so I'm asking some rather basic questions here. Thank you. Jen Gursky, you are back again. What do you have?
I am. I think that the fundamental question of who responds is truly the thing that will feed the pipe for decision making here. So based upon that, I'm just going to throw out that in my work and in YWCA's mission, I think the diversion aspect is my main why I come today to this table. I think if we can help from a decompensated individual who can't self-regulate, avoid the justice system, then we've done our job as a mental health system. And I think determining then how that is, and I don't think that I'm unique from any of the partners that I see here at the table. I think that that's a common held goal. And I get the safe transport, but that also feels like a tertiary answer to the basis and foundational question of how do we divert from the criminal justice system? And I think are a great call on being able to save capacity and resources from law enforcement. But I would go step one further of, do we have the abilities to divert that response in the first place? And I get, like, Kelly's doing a great job. I think I see Judge Peterson on as a person who is personally close to the courts. I get that. I'd love to see what our response can be before people have to appear in any of that. So I think who responds to a dispatch is a really good fundamental question. And it seems like we're getting to the prescriptives before we answer the philosophy.
Do you have a suggestion on where to go now?
No, that's your job.
That's sad. That's really sad. Jaden.
Yeah, we ran the numbers. In last month, we had 177 calls, and we'd only needed to transport 34 of those to the ER. The rest of that number were serviced in the community and remained at their house. So 34 went to the hospital and 3 of them went to jail. And I'm not sure why they went to jail. But that's less than 2% actually go into the system of criminal justice of any form, any kind. So I think that is important. Yes, I understand handcuffing people can be traumatic, and I get there's a myriad of reasons why not to do it, but it's kind of the exception to the rule. When we're seeing the people out in the community, we have a very good success rate of keeping them in the community, in their house, with their loved ones, and hooking them up with other resources such as Good Sam's or Center for Mental Health, because sometimes they've fallen off their meds or they missed an appointment or they don't know where to start. So we do have quite a bit that we are able to keep in the community that I think is important to remember. That's a large portion of who we respond to.
Well, this is the goal of the of Kelly's department, the Criminal Justice Services, is trying to keep people out of the slammer and keep their jobs, keep their families together, and help
I
them.
would say out of the slammer and out of the criminal justice system are two different things, though, Tom.
True. We're trying to get rooms open at the detention center.
Right.
You're shaking
like
your head no.
Only less than 2% of the people were arrested and taken to jail.
I understand that.
We have, and we do actually, we'll go into the detention center and work with them when the detention center staff, the mental health isn't there for whatever reason. I mean, the staff at the detention center does a great job. We facilitate them as well.
If less than 2% are turning in, like, needing to be detained, and what was your percentage on transport? 5?
I'm not sure the exact percent. It was 34 people out of 177.
Okay,
This is-
so like
this is Jolene.
25%. So
Yeah, and this
only
is-
25% need transport.
Hang on, Jolene.
Why aren't we using a CRT to respond if all of those are community based? Like, if they are all being able to be regulated and be kept safe in their homes or in the community, then really that answers the response of, then at least 75% of the time, we don't need law enforcement.
No, Jen, that's not true. This is Jolene. We need to have law enforcement secure the site because the MCRT don't carry weapons. They can't control somebody who has a direct threat. And so law enforcement needs to secure the scene first. And what Jaden's just trying to say is over 50% of the individuals that were seen in the first 8 months of MCRT were able to remain in the community. I believe it was 59%, and be treated right in their own homes and stay there and receive safety plans, have the calls made to get their crisis, behavioral health crisis under control, And I think we had 2 arrests and 2 that were arrested in that 8-month period. That was it. And so that was out of 172 people in the first 8 months. So I think we're going to probably come close to, based on this past month, doubling the numbers that are being seen. And it was, I think, just a process of newness to bringing the MCRT back, and working with the law enforcement and getting a little bit of confidence that they were going to be here, and the professionals were going to be able to really assist the law enforcement. And so I see this as hitting 300 for a number of individuals that are.
So then, Jolene, is what you're saying that those arrest numbers come after folks have been stabilized and there actually was some sort of criminal offense, but for all 170 of those calls, law enforcement were needed at first step?
They cleared the scene before MCRT was called. I think there might have been a few that MCRT did respond direct to, Jaden, I believe, at maybe our place drop-in center. That was maybe, it's not a regular practice, but it does happen occasionally.
From your position, do you think that remains necessary?
What
remains? What happened. Is that model still necessary?
Well, it's worked pretty well with safety. So I think it should continue, I think it should continue with plans in the future to consider how they could respond in certain situations independently. But we're going to see how much demand the HPD puts with calling MCRT to see more often, with protective, custody possibly. And then I know was like 1 month of 140 calls for behavioral health, and MCRT was only called on 20. And some of it was maybe MCRT wasn't on schedule that day, but there is room for a lot more capacity usage. And with the county request and the county matching grant for July 2020, when the new crisis call center comes in, the goal is to have an MOU with the crisis call center 988 system to be able to call MCRT direct at that point in time, once something's worked out in a contract and an MOU. So that would be sort of separate. How do they identify them as less of a crisis? I'm not sure. That's all got to be determined with the planning process there. So there will probably be 2 different pools coming to MCRT next year for calls.
Okay, we have a hand up with Dana. Do you want to follow up, Dana?
Oops. Yep. Can you hear me? Yeah. So I guess my role on this group, and I appreciate being part of it, is just as a citizen. And so I would like to just back up a step and summarize kind of what I'm hearing, which is a few things. All of you probably already know this, but there's a critical point at screening. When the calls come in, there's one central call place, it's 911. So if a citizen or a business is worried about an unstable individual, the only place they're going to call is 911. Then it's going to go to Zach and his staff. And that screening part that Jen was talking about earlier, how do you break this down if it's a trespasser at a business or a transient in somebody's yard, really does seem to start at dispatch. But then what I heard from the hospital behavioral health unit is that they're now listening to all those calls. Is that right, Zach? Or do I have that not correct?
I think that was, and Chief Hagan can correct me here, but I believe that's what we had talked with the hospital about earlier today, is that they would start just listening to the radio more.
This is exactly what we talked today during our meeting the monthly meeting with law enforcement. Yes, and we are already listening to the radio, but we are still waiting for a call for dispatch right now. But starting on Tuesday, we will get the initiative and make the decision independently to move on and attend the scene right away. This is the only difference, with the purpose to short the response time.
That's great.
So I think there's already something to celebrate. I mean, I think that's tremendous. So the screening is going to have mental health listening. A couple of goals are, one is always safety. Another one is try to reduce the amount of time law enforcement needs to engage in a case where it's not a criminal justice response that's needed, it's a mental health response that's needed. And I have a question about that. And maybe Leo Gallagher or Judge Manhan or, any of the rest of you could help with this, the chief. So what maybe is assumed knowledge in this group, a lot of establishing safety or determining action is tied to code. So is the primary code safety to self, danger to self or others? Is that the primary code we're looking at when we think it's a mental health call? Or are there some other laws that are coming in to apply here that law enforcement has to assess in every case that makes it more difficult for law enforcement to disengage from a mental health call? Like, are we missing anything? Is what I'm wondering. Or maybe I just don't know. Like if a physician calls 911 and says, I have a client who just called me from home and they're suicidal. And dispatch says, do they have weapons? And the physician says, I know they don't. I want a welfare check. Could a mental health only unit respond to that? Or would law enforcement still have to respond?
Judge, what do you think?
I can't answer the last question related to a physician calling 911. In all the years I worked at the county attorney's office, I don't recall that ever happening. That might be a question for Zach. I do think that Dana's right that, the question here is, Chief Hagan said we would need a good model regarding our response to mental health or people from suffering from a mental illness. If you look at the Helena Police Department's policies and procedures, it essentially mirrors what they're allowed to do under the Montana Code annotated. And so I said last week, I'm perplexed why the city commission has even asked for a working group when the City of Helena Police Department's policies mirror what they're allowed to do under Montana law. And what I said 2 weeks ago is that our community, I think, is probably more forward thinking on mental health issues than any other community in the state. If you want to get into the minutia, whether people should be transported by law enforcement, you have to understand why they're being transported. A person who's being transported to the emergency room at St. Peter's Hospital in a police car is because they've been taken into protective custody under Title 53, and if you read the Helena Policies and Procedures Manual for the police department, they have the authority to take somebody into custody if there's an emergency situation, if the person is a danger to themselves or others or substantially unable to care for their basic needs. So they're taken into protective custody. Their rights are being violated at that point. Law enforcement have taken them into custody. We don't call it an arrest, but that's what it is. They've taken them into custody for purposes of an evaluation and transported them to St. Peter's Hospital. Or a mobile crisis response team therapist has responded to this scene and said, this person has a mental illness, and because of it, they're a danger to themselves or others. So law enforcement takes them into protective custody and transports them to the hospital. So I think that questions here about whether or not to transport them in a CRT is academic. It's a nice thought, but it's divorced from, I think, the danger that these folks pose to law enforcement, to CRT and others. And it's divorced also from the Montana Code, which the police has to follow. If the Helena Police Department isn't transporting them in a law enforcement off vehicle, then they're not in protective custody. And if they go off and kill themselves or somebody else, the Helena Police Department's going to have to answer why that's the case. So I don't know if this answers your questions, but I think that the Helena Police Department, their policies now mirror what's allowed under Montana law. The community has stepped up to provide even more resources in the community. 20 years ago, we worked really hard to get a crisis response team, which are 3 therapists working 24 hours a day, 7 days a week, to provide on-call counseling or on-call therapy for people in crisis. We're doing that. Now we have a mobile crisis response team. I just don't see how we're going to modify any of the policies in the Helena Police Department. Yes, you can provide more resources, but
So
I have had
if I
a
can
few-
chime back in, Mike, so that was why I wanted to get this tied back to code, is we could, I think this is an important discussion, and I think we are very forward thinking, and I think the hospital coming online next week is amazing. But
I do
if we
too.
can't, yeah, if we can't change the basic legal responsibility for our law enforcement agency, then I think what I'm hearing as a citizen in this group is that the demand for those types of calls is increasing really significantly. It's
that I
probably-
don't know.
Yeah, I think they've done some numbers tonight. So the number of calls involving mental health issues is increasing. It is a real significant drain on law enforcement's ability to be responding to other situations where citizens need help with a criminal justice, a crime, or an obvious safety situation that's happening right then. And so we can't divorce from the code, policy, or procedure. So what I think this group is trying to figure out is how to increase the resource to law enforcement to minimize time where they're at scenes where they aren't the primary resource. Because there doesn't, I don't think there's any way
but
we
I
can
think
stop them
that
from coming, right?
that's happening. If you recall last week, some of the law enforcement officers said that before the crisis response team, and particularly before the mobile crisis response team, and before St. Peter's engaged the services of a certified mental health professional in the emergency room, law enforcement was spending an inordinate amount of time holding a person at the emergency room, waiting for a mental health professional or a doctor, an ER doc, to conduct an evaluation. And the ER docs always put the mental health crisis at the end of the queue. And that's not happening anymore. So law enforcement are spending a lot less time at the hospital, and I think probably less time involved overall in dealing with people with crisis. The other thing you have to consider is that the number of involuntary commitments to the Montana State Hospital from Lewis and Clark County has dropped precipitously in recent years. And I think that's largely because the behavioral health unit at St. Peter's Hospital takes a lot of these people on a diversion. We are seeing more people detained at the Montana State Hospital on an emergency basis because there's not room at the behavioral health unit after the journey home closed. That's put a lot more pressure. But in terms of law enforcement spending more time dealing with people with mental illness, I'm not sure that that's the case. I think their problem is that they deal with a handful of people over and over again, and that's an increase, that's a frustration for them.
I do think, and that all makes good sense, Mike. And it's a longitudinal look at it too, which I think is really helpful. I believe our law enforcement partners when they're asking for help, and I appreciate that the city commission, responded and maybe initiated this conversation in summer 2020 when there was a possibility that part of the police budget was going to be directed to mental health care for kids in schools. So I think we need to be in the conversation. And so I just wanted to reflect what I'm hearing is that we've actually done a pretty good job meeting the need in the last couple decades and have been on the forefront of some things like that in Helena, that our partners, our mental health partners in the community are very engaged trying to support the law enforcement response and trying to respond appropriately to our citizens. But it's still not the level of resource that we would all hope for. And is it possible to advance it another step? And if so, what resources do we need? And then I don't think we can ever forget that it's tied to code. Like law enforcement is not going to be able to stop responding. So that's for our community. I don't even know if that could be on the table. It, you know, maybe it could be like in New York City where they have the homeless outreach teams and they have their, I mean, they have pretty cool stuff in other towns, but I don't know that we have that resource. So I just wanted to reflect all that while I've been listening. I don't have the solution, but I wanted to kind of tie us back to code.
Thanks, Dana. Say, I see we have Matt with his hand up and Dennis with his hand up, but I'd like to go to Leo Gallagher first because he has all the answers, always has.
No, I was going to answer Dan's question. You got to have a cop take him to jail, or to the emergency room. As the judge said, if it's a detention, the code says it's got to be a peace officer who's determined the person is a danger to himself or others. So, you know, for this plan to work, you're going to have a peace officer involved.
Okay. Matt, do you have something to add to that?
I guess I initially put my hand up when they started talking about the jump in calls. I wanted to clarify why that's probably going on. When I respond to a scene, initially it was taking a lot of time, and we're always prioritizing our time's what we run out of. So we were not calling CRT on every mental health call because at least my understanding was they were for crisis, mental, whether it was a protective custody or not. And we're already trained to make that assessment. Like Leo just said, we have to transport them at that point. Didn't make a lot of sense for us to wait on scene. Since our last meeting, we have talked to a lot of people. We've been trying to call more, and over the last couple of weeks, we've had some great contacts with MCRT coming out and helping with some people that are struggling, but they haven't hit that level of protective custody yet. So I think that's, at least from my perspective, a positive thing that we've been looking forward to, and probably why they're seeing more calls as of late. Last time the judge brought up community commitment. I think that's one of the things that we're hoping eventually comes out of this. Another option that I'm hoping gets discussed is a way that we can get somebody to mobile CRT or a CRT worker at some location that may not be at the hospital. A lot of times people just want to talk to somebody and they're asking us for help, and they may be on the streets, they may not have a safe place. How do we, if we are going to give them a ride somewhere, how do we get them somewhere maybe that we can then introduce them? I like the warm handoff that was mentioned last time. And I don't know if that's a possibility, but it's something that I think would drastically cut down on the amount of time that we need to stand there awkwardly in the back of the room once we've done the introductions and everything's safe. And the only other thing that I can think of that would really help from my perspective is if we could maybe talk to the security staff at St. Pete's. I worked hospital security for several years while I was going through the police academy in Minnesota. And the way it worked out there is the officer would show up and they'd take off their handcuffs, and then they were in my charge. And as a security officer, I stood by there, and if they tried to leave, took over. So at the moment, that's not something we've been able to work out, I don't think, but I'm curious if that's another way we could help free up resources.
That would be a hospital decision, or would that be a community decision?
I guess that would have to be the hospital. But that's just another area. Maybe we could focus on a meeting place. I think the city would have the ability to help with that topic.
Interesting. Thank you. Dennis, what do you have?
So I guess first thing I want to say is I agree with what Judge Minahan said about, HPD's policies and mirroring code, what the code is and what they're doing. They're doing what they need to do. If you look at Eugene, Oregon's model, the cahoots, you got San Antonio, you got Miami-Dade County, you have Denver, what Zach was talking about. You have it doesn't matter what model you're looking at. If you look at any of those models right there, there's a common denominator. Yes, you have law enforcement, or you have mental health, or you have a combination of the above, or EMTs, or whatever. But you have to have, and I guess before I say what I'm going to say here in a second here is, for the last 20 years, our system in Helena has improved. I can tell you what it was like 20 years ago, 10 years ago, and things have been improved. We've had a couple hiccups in the last few years, last 3 to 5 years, we've had some hiccups. But any one of those models you look at, you have community / stakeholders collaboration. So yes, law enforcement is doing, I think Chief Hagan has showed in their policies that they're doing everything that they're supposed to be doing and how they're supposed to be doing it per what the codes say how they're supposed to do it. But we as a community, and I'm talking about St. Pete's, I'm talking about the mental health facilities that are in our town right now, the mental health professionals, all of them, we all have to be working together. The collaboration has to continue. It doesn't just go, you start going, things are going good, and then things fall off. We have to, as a community, I can tell you a couple of those models. I know the collaboration of the community is why those are successful models.
Do we have that collaboration here?
I think we have bits and pieces of it. Yeah, I think we've had quite good collaboration for a long time. I think there's some of the collaboration needs to be worked on, but I think we've had that. We were doing well for a while there, and it's we've had some issues, like I said, some hiccups the last 2 to 3, 4 years. And I think we just need to make sure that we're working as a community together. And I think
how does one get that collaboration together?
Well, the group of people we have in this meeting right now is a huge list of stakeholders and the community that should be collaborating together and working together as a team. So anyway, and that's not really giving a resolution, but I can tell you the models, a couple of those models that I've read that I've just mentioned to you, the Eugene, Oregon and San Antonio, it's the community working together, mental health, the hospital, the law enforcement, everybody working together and a common goal that they want to make it better for their community. And I think we have a lot of people here that want that and they've been working towards that, but we have to work harder. So anyway, that's my 2 cents.
Well, give me another 2 cents. What do you think our resolution for this should be? Off the top. Start us here.
Boy.
Are you happy with what's going on?
I think we are going in a good direction for a while there. I think we've fallen off a little bit.
What happened?
I don't know. Well, I'll just give you one example. I know this was brought up once, but
please. And
I know Chief Hagan was talking about journey home. Journey home is not the all answer, but at least when we had the journey home and it was getting to the point, and what he's saying is we need to be able to have law enforcement have the ability if they or the mobile crisis mobile unit team goes to a call, they have to have the ability to go to the journey home, which when we had the journey home, you have to have medical professionals there to clear them medically before they can go on with the mental health process. Mm-hmm. And I think they were working towards that. It had to do with staffing, had to do with you had to have the medical personnel, and they were working towards that. And then we lost the journey home, and then now we've went back I think we've kind of went backwards a little bit, because now we're going back to some of the same things. Now we have the mobile team that's working, that's helping with that. But that's one system that I think when we lost it, we lost some ground. So I don't know. That's one thing I guess I could say that would be helpful.
Yeah, and as a clarification, it's not just the home itself, it's the certified people that run it. And there's a problem finding those people in Montana.
But you have to have the staffing, mental health professional type staffing, but you also, to make it even more usable, you need to have medical staff, a nurse, or someone that can medically clear those individuals to make sure it's not a medical issue, that it's actually a mental health issue at that time, not a medical issue, a UTI or whatever, something, or diabetic or something like that they can clear them medically.
Okay.
That's what they were working towards. And then we lost that, but that's just one example.
Well, I like what you're saying. Let's go back to my original question. Are you happy with the setup now of sending a police officer first, followed by CRT, and then determining who stays?
Loaded question, but I think there's always going to be the issue of safety. And so I think, and unless you can find, and I don't even know any of these other models, if you're going to find a perfect system that's going to say that scene is safe so that mental health professional can go there and do their job as a mental health professional, and I have to deal with an issue of violence or something happening because of the situation. So I think there's means that we can be better at. And but I think law enforcement, my opinion is law enforcement right now anyway, or the near future, they need to be going to the calls. So
Thank you. I put you on the spot. I appreciate that. Anybody want to jump in, give an opinion? Anybody?
Well, yeah, Tom, I have just a couple clarifying questions, if that's okay.
Yeah, the people are
So
here.
at our last meeting, there was a discussion about a scenario where a provider who knows the individual is not a threat, police right now being the responder in that circumstance, perhaps with the mobile response team. My understanding from that conversation we had 2 weeks ago was that there are efforts right now to move away from that model, at least in some circumstances. And my understanding from our meeting just on Tuesday with the county commission, I think Commissioner Hunthausen sort of articulated the same thing, that moving more towards best practice in circumstances where police aren't necessary. So I'm wondering if someone could give me just a little bit of clarification, because it seems like there are circumstances where even under the current Montana statute, where we are already thinking about moving toward a response that would not include police in some circumstances where it's deemed not to be a safety issue. Is that accurate? And I don't know if Ms. Jennings or someone else who's been part of a couple of these meetings, if I'm misunderstanding that, that would be helpful to understand.
Who wants to grab that?
Well, I'll just say that, Heather, that was me, Kyle Johnson, that brought up that example, and it was my client. And Jaden is on the call tonight, and he's the one who I called directly and just said, hey, I've known this person for years. Like, I know their issues. I can, guarantee. And he explained it to me thoroughly. And, there's just so many things that I agree with that have been said tonight. I work for one of the 2 FQHCs in town, and one of the things we really try to do is minimize the amount of people that have to go up to the emergency room. We want to keep people in the community. We want to provide ambulatory care for people that can walk in and get our services. And I think, when Chief Hagan opened this meeting, one of the things we wanted to address was the people that haven't gotten to that crisis level yet. And I feel like the last 2 meetings, that has taken over the conversation. So that was me that gave that example. And I have about 100 more where we've tried to do our part. And and used trauma-informed care and actually called the police. And then we didn't want to have our clients go in handcuffs. And I can't say enough about Chief Hagan's officers. They're just wonderful. But we've driven people up to the emergency room to make it so they didn't have to go in handcuffs. And I just can't echo enough that I think it has to be collaborative. And I think each individual community member's needs are different. Each individual person is different, but I've done some of those assessments, and I know that we worked with people who are a threat to themselves, and then we take them up to the hospital, and because they're over capacity, they're out the door an hour later. And so there is gaps in the system, but I think I can't help but feel we got off track a little bit, because we're not talking about some of those people that haven't gotten to that crisis level yet. Some of those people that can be intervened within the community, in some of the community resources that we do have.
Hey, anybody else?
Well, and that was kind of my question. Is there a scenario where if a physician, so someone isn't doing very well, say they're very depressed, they call their doctor, and their doctor knows them really well, knows there's no weapons, no immediate safety issue for the environment or other people. But right now, the only thing the doctor can really do and not be liable is call 911 and say, I need a welfare check on this person. So if there's a high enough level of qualified person who identifies the problem, is there a way to do that without law enforcement needing to respond and still comply with code? And that was kind of what I was hoping for too, is how do we ferret out the cases that don't have to go straight to 911, if there are any?
Right. And I think that's what
I think. Right.
Yeah, and I think that's what maybe Jen was getting at. And it sounds like, Zach, you've sort of looked at other models. I mean, I think that seems to be the sort of ultimate question, is who's responding and how is that decision being made? I do think that I understand that there is statutory limitations on what the police can and cannot do. But I think we're potentially trying to take a step further back in the question of, is police necessary in the response? And if not, are we limited by the statute? Because that's where I'm not quite clear. And it sounds like maybe this is something that the mobile crisis response team is looking at based off of what Commissioner Hunthausen articulated on Tuesday.
Judge, you still with us?
O'Loughlin, this is Jolene. Can I answer a further question for you? I mean, do you feel like you've gotten all your answers, or do you want further information on MCRT?
Yeah, I mean, is that accurate to say, right? I mean, it sounds like this is a movement happening already, that sort of stopping short to say police just have to be there because we have a Montana statute. I'm a little confused based off of what was articulated on Tuesday.
Yeah, I would just from my perspective, I would just say there's what changes are happening right now. I wasn't even aware with Gianluca and law enforcement deciding to go side by side with being on that call, to be able to listen in. I know we talked about co-responding it more, so there was more timely response. But this is obviously a step forward beyond that. That is really MCRT through St. Pete's is making a big leap forward to try to help with that, to respond quicker. I think there's another component that is not actually directly going to law enforcement right now, which is sort of I guess on the side going to law enforcement, and we have to figure out, and maybe dispatch can come on and talk about this a little bit, is the 211 calls that go through that end up get redirected to dispatch. Those are the calls that can be prior to 911 law enforcement calls that have the opportunity, based on the crisis call, center model that the whole nation is taking with the 988, which will be launched in July 2022, which is the MOU, and the definition of that is still being fully defined in the state. It's in process. They have a quarterly meeting that takes place, and the call centers that are currently existing are working on defining how they're going to take just crisis calls, and then the 211 is going to handle the social determinants of health, the food, the shelter. So I'm not sure if those will sort of be increased to be handled by them and going direct to MCRT or other services, and that maybe those calls will less flow through to 911. I don't know all that. Those are some things that are happening in the community. So I think that's the other side of what Commissioner Hunt-Addison was talking about. And it is still fully needing to be defined. And I think we have a meeting coming up in about 2 weeks. So I can share that information with you when it becomes available. I think it'd be nice to bring you into the loop on those meetings.
Chief, you have your hand up.
Yeah, I just want to kind of touch base. I think we kind of got our wires crossed and back and forth. We got into several different conversations. Like Judge Menahan and Leo said, there are obligations under the law that we can only do. But what I'm asking for, and I'm hoping for help here, is to get on the non-crisis calls. So I would like help before people get to that crisis level, to hand people off when we indeed have a mental health issue and they don't need to go to the criminal justice system, because what they're doing doesn't raise to that level. Can we have a mental health professionals respond to calls? I think that's something we need to determine as a community. Your law enforcement and the mental health professionals that are responding are really the mental health professionals have to make that decision. Are we willing to do that? We can say, well, mental health professionals, you're going to these calls. But if we don't get the mental health professionals to buy in that they're going to go to those calls without law enforcement, then I think we're just kind of wasting our breath, because we have to work together. Like Dennis said, we have to collaborate on all of this. And the fact that we have this many people on this call is amazing. The fact that we have a police officer, Matt Lewis, who's in Minnesota on vacation, who believes enough in this to be on this call, tells you that law enforcement isn't opposed to getting some help in this. Yep, we're the only ones that can place someone in protective custody. They're in custody, they've got to be transported by us. But if we can get somebody where they don't meet that level of protective custody, and we have somewhere they can go, and someone else can transport them, we're all for it. So I think we kind of we're all trying to focus on the same thing, but going different directions. So I think at some point, Tom, we've got to get control and maybe either decide if we're going to make some recommendation to the commission, or if we're going to go to another meeting in no more than 2 weeks from now.
I'm in agreement. Where do we want to take this? Let's see. My original thought was that dispatch could make that determination, but I'm not sure Zach, you qualified to do something like that?
And that's where I'd hesitate. I mean, we have very basic questioning we do, but we are not trained mental health clinical therapists, for lack of a better term. And I would hate to ever get into a situation where we take a call, say it's from somebody in the community that we all know, and we ask our normal questioning, and we say, okay, they meet all of their criteria. We're going to send just a mental health unit to them. And then for some reason, that's the day that person has their breakdown further, or they're under the influence of something else that they didn't disclose or we didn't get, and then cause harm to that mental health unit that responds. So I don't know if I would want to take that on within the center. Because we do have minimal training. We do have a group of us that went through CIT training, but not all of us.
It sounds to me like we send both to do it right. I don't see an option unless there's some kind of committee that decides, and that's ridiculous to bring in a group to decide what an emergency call would, how an emergency call would be handled. That's wouldn't work.
And I guess I would just say I would really default to MCRT and their comfort level of, do they want to even go down this path of, does their current staff feel comfortable right now? I mean, I won't give names, but they know the names that we deal with on that continual basis. I guess, would they always feel comfortable going to those calls, knowing that law enforcement wasn't going to be there? And the other flip side to that is, my concern would be, if they get there and they need that assistance, there are times that we do not have officers available and we would have to pull them from calls, and that prolongs their response time to get there. So it's just something else that I've been thinking about when it comes to that.
Matt, do you have a? Go ahead.
Sorry, this is John Luke. I would like to do a little intervention on this. You know, there is no doubt that many of the calls that law enforcement receive are probably they could be handled by MCRT independently. The problem is, and I want to anticipate that my team can't wait to be unleashed to any call. But the problem is that if we have a statute that the regular response to law enforcement and how to transport a client in a specific situation and all of these, there is a reason there. So we can definitely ask the MCRT to go and answer this, but who will assume and absorb the responsibility of something that it will have a bad outcome. 99% of the time, it will not happen. It will not happen. But it just happened once. I feel that as a director of this team, I'm gonna fail. So I think if we want to have another meeting, we should probably focus on how to structure this, the liability, responsibility, or the law around this, laws, I'm sorry, and work together, but with the expectation that one meeting would be not enough to solve this. Maybe we need to work a little bit more together and longer to figure out if it would be appropriate for the MCRT to respond independently without the support of law enforcement to the community. Again, my team is willing to do it. It will do it right now. It will do it yesterday because they asked me to do it all the time. But we need to put a break there because there is a liability issue that we cannot ignore. I don't know if this makes sense, but I think this is where, because all this discussion ended up then on the response of the MCRT. And I agree. I mean, they are probably the only team now. But maybe we need to work a little bit together to define and see where the responsibilities are. For example, I'll give you an example. If a patient is discharged from VHU, AMA, or not AMA, against medical advice, and within 72 hours commits suicide, we will need to go through investigation, review of all sorts of review. And this will be the same, I believe, most likely will be the same thing that will happen if we have a bad outcome with the MCRT responding to a call that we were not able to control. So this is my concern, and definitely we can follow up and meet again, but maybe maybe focusing a little bit on specific topic, and because it's pretty serious in my opinion.
Okay, I'm thinking, excuse me, that if we could come up with some sort of a response decision in this meeting, that would be a discussion for later on. Is there any argument with that?
Yeah, this is Jolene. I really think that we need a summary of what happens in this meeting and send it out to everybody, and we really schedule another meeting to focus on the areas we need to focus on, or we agree to focus on, so we can get an answer. I don't think it's something we should be rushing into with all this conversation that's happening. It's my opinion. It's my opinion.
You're entitled. Anybody want to chime in?
I just want to say that with all of the people that I have worked with, and there has been a lot, there has been less than a handful of times where I felt unsafe, or that the person was, I don't know, in any kind of a threatening way. I just,
Jen,
I don't know.
I agree, but is that handful of times my problem, which is enough for me.
But that's when you get the police involved. I mean, it's not, we're still talking about people and humans that not everybody is going to respond well to police, and they will respond better to a plainclothes person coming up and working with them, figuring out what's going on, and help them get to the Center for Mental Health or whatever it is that they need. But it's just, it's not always unsafe. And it's just my experience, but.
Well, I believe that's happening. I have no doubt about that. Chief, in that case, I'm not sure we're going to solve anything right in this sentence here, but do you have plainclothes officers that can show up and sort of take care of that threat?
No, I'll just say that we don't have the resources to do that. Our officers are responsible to respond to anything and everything from mental health type calls all the way to domestics, DUIs, you name it, they have to respond to it. So on an average shift, we have 4 to 7 people. We don't have the resources to put folks in plain clothes. I loved the model that San Antonio has. They have mental health officers, but they have 11 people dedicated to that mental health program. I've lost 11 officers in the last year, and we're still 6 short. So it's 5 short right now. At the end of the month, we'll be 6 short. So the resources are not available to focus solely on mental health on a law enforcement response. Whatever the resources are, we need more of them, whether they're more officers or more mental health. If we're talking response to mental health, I think we need more caseworkers and more case managers that can work there. And I don't think we're going to get an answer tonight, Tom.
I don't think
maybe
so
we
either.
should focus. We got one hand raised, I think Charlie Lane, but I think after that, maybe we should focus on figuring out when the best time to set another meeting is.
Charlie, what do you got?
Thank you, Chief Hagan. Thanks for inviting me into this, and thanks for the opportunity to speak. I'm a deputy county attorney with the county attorney's office underneath Leo Gallagher, so I'll try not to talk out of turn because I'm sure he's still watching me. I was just going to try and summarize for my own sake where we've kind of gone through here today. I heard Chief Hagan say early on, it's probably not worth trying to rebuild the system. We should probably work with what we've got. And from what I've heard from the mobile crisis response team, is what we have is they are not comfortable sending their people out without police presence. So there's kind of a linear progression of a call and how we how the police respond and who can respond. And when somebody is in crisis, there really is just one number to call for either a welfare check on an individual who hasn't committed a crime, or if somebody has committed a crime, it's still the same number, and that's going to get routed to the police. If that was diverted to mobile crisis response, from what I'm hearing tonight, is they would prefer that police respond also for their safety. So we end up kind of in a cycle there with the police are responding. Once they're there, we have mobile crisis response can respond. They can assist the officers, but the officers make a determination. Is there a crime? Does the person need to be put into protective custody? The result of either of those being yes is that person's going to be put in handcuffs per policy and either taken to the emergency room to be evaluated by a professional person for their safety and others, or to the jail where they could receive some services. The other opportunity for some sort of intervention, from what I've heard, is at this step if they're not being taken into protective custody, if there isn't a crime. And that's the handoff where I'm seeing an opportunity if the city does want to spend some funds and get involved, are those resources and possibly spending some money for the nonprofits that exist to take that warm handoff. So that's kind of what I've gotten out of tonight. Thank you.
I agree. Judge Menahan, do we have room to move within the policies?
Well, the one thing that I heard that Dana Toole focused on was that there are some circumstances where maybe law enforcement isn't required to respond to a scene. But if somebody calls 911 and is looking for a law enforcement response, that's what they get. If you want to develop resources into the 211 system to try to flesh out a system in which mental health professionals feel comfortable responding without law enforcement backup, maybe that's an opportunity. Personally, I just don't understand why the city of Helena would be engaging in this activity not in conjunction with Lewis and Clark County. I just don't see the city of Helena having a response to people in crisis that's different from people that live outside the city limits. The mobile crisis response team responds to both people in the city and out of the city. I truly think that this is great that people are talking about this and this is collaboration, but we've been involved in collaboration between all the interested parties for the last 2 decades. What you're doing here is not any different. It's just a continuation in a different way. I don't see the point of having another meeting. No one has been able to articulate a policy change that they want the City of Helena Police Department to adopt. I don't see the point of this.
Spoken well. Opinions. This is your chance to get a judge.
Commissioner Logan has his hand raised, Tom.
Oh, he does. Commissioner, what do you have? Thank you.
Thank you, Chief, and thank you, Chair. I think Judge Menahan pretty much just stole what I wanted to say. I mean, I share his state of being perplexed. I'll try to keep it brief, but I thought when we got into this discussion that we would ultimately find out that HPD, I mean, that was the original focus of this, was HPD and its policies across a spectrum of issues, and mental health being one of them. And I think what I have found has been that HPD has been a very forward-thinking organization. I started with the city in 1996. And so that was 26 years ago. And I watched the progression of HPD over that time. And as Judge Menahan said, great strides have been made. I do struggle with the focus of
this group on the city of Helena. I think Judge Menahan just alluded to it, and its police department. I think what we're finding here is that this is a big need that needs to be addressed within our community, not just the city of Helena, within our area. And HPD is a part of that. The city of Helena is a part of that. But I think it's a much broader discussion. And, you know, I guess I'm also in agreement with Judge Menahan that I don't know that another meeting is going to really solve anything relative to HPD, City of Helena, and its policies. I think what we found is we've just opened the door to a really far larger discussion that needs to be had. Thank you.
Could I ask the commissioners if they're interested in looking into whether they want to go with a nonprofit, or that would be a replacement to the hospital, so I don't see much of a reason to switch that off unless you do. So I don't know where we would go that we're not doing something already. So I guess I'm leaning.
I would agree
towards the judge. Anybody?
Well, I would just say, I mean, I think there have been some comments tonight that there could be, and including from Chief Hagan, I think a willingness to think about what could a model look like. I would agree, Tom, that we're not going to reach that tonight. I think it would be helpful to maybe poll folks and get a sense of where they'd like to go with this. I think we haven't necessarily heard from everyone tonight. So perhaps that's something that can be done through, you know, email. I would also just say, I mean, I really appreciate some of the teasing out, you know, what would dispatch need? What would the police force need? What would the community and nonprofit sector need? And sort of thinking big picture about what could this system look like. That isn't necessary. It is not going to change overnight, right? I mean, I very much understand the limitations of the capacity and expertise of dispatch. Is there a model out there that the city and county might want to strive for down the line of like what training, what is a decision, you know, triage system look like, so that we're reaching folks, as Kyle said, that aren't necessarily in a dangerous situation or even in crisis, but are right now today calling 911 and and police are responding to. You know, are there things that we can and should look to into the future? It is not going to change overnight. I don't think that when the commission began these conversations, which really started with presentations from Chief Hagan and the police force about what are the issues that are bubbling up for you all, this continues to be something, right? So to say that the city doesn't have a role, we do have a role, right? It is the police right now. Is that the right model? Or is there something else that we should look at moving forward? Now, if this group does not feel that the appetite for continuing those conversations, I think that should be conveyed to Tom, perhaps over email. But I do think that this has been helpful in sort of teasing out there are circumstances where the response could look different. It does look different in other communities. And is that something we might want to strive for? So that would be that's my feedback. I think that there's a number of voices here that maybe have a perspective, and perhaps it's worth getting that feedback either to you or Chief Hagan separately.
I'm uncomfortable with another meeting only because we seem to be circling and not landing somewhere. We've had material suggested readings that would clarify things to do, and those haven't been brought up except for maybe cahoots. I wonder how many of you want to meet again, and if you, I've asked for suggestions on where we should take this, and I'm not really getting answers. So we have to do this month. We want to do this for Hagen because he wants to go out as a king. So I
would just say, Chief Hagan, I'm comfortable if ultimately it's better for you to just simply come to the commission and make your recommendations. I think you have ideas. I mean, I think Ms. Gursky articulated that. Maybe that's a better, a better conversation to have. I think that there have been some ideas bubbling up that perhaps it's best for the commission to discuss instead.
Chief?
So I think, Tom, we should maybe call for a vote of raise of hands. Should we have another meeting? And then maybe we actually, that almost sounded like a motion, Commissioner, that maybe that's the solution, is that I make a suggestion to the commission. I don't know. I do have ideas, but I don't think this is necessarily what I want, because ultimately it's not going to affect me. 3 weeks from now, I'm not going to be the person that implementing it. So I'm willing to do that, but I want to know what the group wants. So maybe call for a vote. Do we want to have another meeting, Tom?
I'll go with that. Do we all know how to do that? I'm not sure I do. How do we? Janae, can you help us out here?
Sure.
Tom, sorry, go ahead, Danae. You can take it.
That's okay. So for those of you that aren't familiar, depending on the application or the version of Zoom you're using, you just need to raise your hand. And usually what it means is you go and find a toolbar on your lower portion of your screen, or you tap your screen if you're using a mobile device. And it will ask you if you would like to raise your hand. So
I do not have that option, so I'm at a loss here. Okay. So let's vote, see if you people want to meet again and discuss this further. Raise your hand if you do, please. Anybody? All right, let's turn it around. Let's raise your hand if you don't want to meet again. That's the opposite, right? Okay, I see hands are coming. I'm thinking we're going with Commissioner O'Laughlin and the chief. It doesn't look like we're in favor of another meeting. Comments? Okay. Chief, I'm gonna lean on you to go to the commish with some of your ideas. If they want to bring this back to us, we can give it a shot, but you're the expert and you're on your way out. So I think you should have a departing message.
I will make a recommendation. So I've got 3 weeks, I guess, to come up with it.
You'll be great. Mr. Gallagher, what do you have?
Nothing. I'm ready to go home.
Oh, that was your hand up from last time. I see.
Yeah, right.
I'm ready to go home too. You
All
guys, thank you so much. Send your comments to the chief if you have something that you really didn't want to vocalize publicly, and I wish you all the best. Thank you for your time.
Thank you, everybody.